Hi everyone, Jason Malcom here again from the Parkinson Center of Oregon, back for our second installment of Ask the Doc for Facebook and our OHSU Facebook page for Parkinson Center of Oregon. And I'm here with Dr. Elise Anderson, one of our new fellows here at the Parkinson Center of Oregon, and we have a couple questions. So for this question, we have Dr. Anderson, we have a question from a patient, and he's wanting to know at what point should or could one consider brain surgery for Parkinson's disease?
Okay, well, the question about surgery is a pretty common one that we get in clinic with our Parkinson's patients. And surgery is an increasingly useful option for management of moderate to advanced Parkinson's disease. What typically happens is the first few years, patients find that their symptoms are well controlled with medication. But after 5 to 10 years or so, they develop what we call motor fluctuations and dyskinesias. So at that time, we often will think about surgery, and here at OHSU, we most commonly recommend what's called deep brain stimulation, in which leads are implanted in patients' brains, and an external generator is used to manipulate those leads for control of symptoms. So when we start thinking about surgery, usually it's when patients find that they have motor fluctuations in which they have pretty dramatic responses to their medication. They'll have kind of ups and downs when their medications are working and then are not, and they'll have bad on-off fluctuations. And then we also think about it when patients develop severe dyskinesias, which can happen after years of levodopa therapy, in which their good motor control is accompanied by extra movements. And we find that we can reduce medication often after DBS surgery, and that leads to a reduction in the dyskinesias. The things that we like patients to know are that the goals of DBS surgery are to reduce the need for medication, but often we won't be able to eliminate medication entirely. And the expectations are important to keep in mind when going into surgery. And what we expect is that patients will get the best response that they get to levodopa from the surgery, but they won't tend to do better than they will do on their best motor control with levodopa. So that's important to keep in mind.
Thank you, Dr. Anderson, and thank you everybody for tuning in to our Ask the Doc segment for our Facebook page. As usual, keep visiting our Facebook page for more of these Ask the Doc questions in the future. And please don't use this as personal medical advice, but if you have any questions about this matter or any other matters, to please check with your neurologist or family care physician. Thank you.